Okay, I hope everyone had a great, obviously we had a great morning, and I hope that you, those of you who are on Capitol Hill, had a good experience with that and actually moved some things forward that we needed. I'm sure after this morning, you were fired up to go talk to your Congress members, so that's great. So welcome to the second half of the second day. I am Sheila Stickle, and for those that don't know me, I am the Western States Field Director, which means that if you live west of the Mississippi, I am your primary contact on outreach activities. So what we're going to talk about now is opportunities and options for community outreach activities. And one that we have had great success with is a tool called the Hello Game. And hopefully you have all heard of the Hello Game, and I know many of you have played the Hello Game. So Donna, my spokesmodel, is in the back of the room holding up the box. We have Hello Games available to you if you commit to hosting one of these events. So this is a game that was invented by palliative care experts. It is a tool that helps us teach about what palliative care means. And it's a game, so it's a great thing. What we're gonna do in a couple minutes is play it, but we're gonna play it as a group. So normally this is something that each table would take on individually, and you have a little booklet, and you would work through it with your table. And just because we're doing this as an icebreaker, we're going to do it sort of in as a larger group, and that will be kind of fun because one thing you'll see is much like this morning, it very quickly sort of bonds a group together. A couple people in the room have been at these events. I was in Nevada with Tom McCoy. His ACS CAN advocates played it in a very similar setting to this. It was even about the same number of people, and I think it really got people's brains moving and got the energy churning. So again, the great thing about having a game called Hello is that there are a lot of puns and ways to use the name Hello. So, oops, I just went backwards instead of forward. Hold on. So, Hello is a fun conversation game created by Common Practice. It's designed to be played amongst friends or colleagues or people that you socialize with, but also it's a game that can be played, or a tool that can be used at a family gathering. It was actually designed to be played sort of after Thanksgiving dinner. It's a non-threatening way. I think it's one of those things, because it's about palliative care, people are sometimes a little bit hesitant, but now that we're so much more familiar with each other, I think you'll find that this will come pretty easy to you. And the idea of the game is to teach caregivers and medical professionals and others to treat people as a patient and a whole person, or I shouldn't say as a patient, to treat people as a whole person rather than just a patient. So what that means is you're way more than your diagnosis, and your relatives and friends and colleagues are way more than their diagnosis. So in palliative care, one thing we're trying to communicate with people is those things you might need. I like to use the example that if you're the insurance holder for your family and you're the person with the diagnosis, your care providers need to know that so that you can get a treatment that might help you continue to work, if that's possible, and those kinds of things. In Nevada, I remember a woman shared quite a bit. She was a horse lover. And if she couldn't, she wanted doctors to know if she couldn't ride horses, you know, then that would be a major impact on her life. So if you're a parent, those kinds of things. So this game is designed to get those kinds of conversations going. I will just tell you right now, I am pressing the wrong buttons. There we go. Okay. So we're going to talk about the rules really quickly, and then we're going to get to the questions. So the rules are very, very simple in this game. They are that it is okay to answer a question and share with the group your answer to that question, it is okay to just write your answer to the question down. There are no wrong answers to any of these questions. So the answers are for you. Like I said, it will get you moving in the right direction here. And please write an answer down to every question. And the last rule, and it's a rule that normally would be more germane if you were playing with just a couple of people, but usually what happens is you would go around your table and share with the people at your table, or choose not to share. Either is okay. In this setting, I'm just going to have people raise their hands and share along the way. Okay, so now, provided I press the right question, we'll get on to the next question. Here we go. So this is actually the question in these little books, but we're going to skip to question number 6. What activities make you lose track of time? This is something that is easy for people usually to answer, so I'm going to give you about 20 seconds to think about it, and then I will take hands. If you need a pen, raise your hand. When you're done, just look up. Normally when we do this presentation, and we have a lot more time, Melissa and I talk a lot about palliative care and sort of clinical definitions of it, because Can We Talk, the hello version, is our presentation, our NPAF presentation to groups, involves educating while we're going and using the tool Hello Games. So we sometimes give definitions, and we did that in Colorado with Shanta and others about 6 or 7 months ago. So, okay, so I'm going to have people tell me what makes you lose track of time. I will start with me. It's shopping. I have to set an alarm on my wrist if I go into Costco because I will forget to pick my children up from school. If there was a call that was going to happen, I will miss it. Shopping is be a complete black hole for me. I know for other people, they will say reading. It's very popular, and that shows the contrast for me and you. But anyways, does anyone want to share what makes you lose track of time? Walking, great. Rebecca. Walking with my dog. Oh, good. Yes.
Going anywhere with my bestest friend, not my best friend, my bestest friend George, or it could be to the grocery store or anywhere in the world.
That's great. So traveling and trips with George. Anybody over on this side? What makes you lose track of time? Yeah.
Sitting by a campfire.
Okay, love it. That's a new one. I like that. Yes.
Gardening.
Gardening, yes. Julie. Riding a horse. There we go. Yes.
Listening to educational videos.
Okay, I love it. Yeah. It's okay.
Scrolling on social media.
Social media,
Totally
right?
lose
That
track
is,
of time.
social media can
It's
do
a
it.
horrible one, but
Don't feel bad. Mine was shopping. Okay. Question 9 in our game. What is the first memory that comes to mind when you think about physical pain? These get a little harder as we go on sometimes. I can see for some of you this is easy. Often I have people who want me to define the question more pointedly for them, so I'm good to see that that's not happening because we don't do that. It gets to be whatever you want the answer to be. All right, we'll start in the back of the room. Keep writing if you're writing, but yes, Becky. Childbirth. I like it. Yeah. For me, my first one, I fell off my bike when I first learned to ride a bike. They were re-graveling the road. And my dad, I was crying. My dad was in advertising, and he was a creative person, and he put ketchup all over me before he took me into my mother. But I think that's why I remember, because there was pain on all these levels. Yeah, embarrassing. Anybody have a, yeah. Recovering from a hysterectomy. All right. Yeah.
As a child, getting hit in the head with a baseball bat when playing baseball.
Yeah, that would stick in your mind. Okay. Right, right. So Tom's saying, watching his mother deal with her breast cancer pain. Anybody else have a memory? Yeah.
My father was a very docile person. Nothing upset him. And my brother and I got these little cowgirl cap guns when we were kids, but they were very heavy metal. And I had the gun. It was just one gun, and I had it first.
Right.
And my brother wanted the gun, so I let him have the gun. By letting him have it, I meant I hit him in the head with it.
Yeah, of course.
So my father, I could hear him screaming from the other room, and I thought, he's coming to get my brother. He didn't. He came and got me. And that was my memory. That was physical pain, like I never experienced.
Yeah, that is also can be one. All right. Anybody else want to share on that one before? Okay.
When I think of physical pain, I can hear my mom say, hard head makes soft butts.
So I will tell you this, the way I do this is definitely designed for extroverts, right? We're all going to learn who the extroverts in the room are. But the game is for extroverts and introverts, because again, sharing is awesome, but we just want you to write down your answers for yourself. So this one is a little more puzzling. Question 11. In order to provide you with the best care possible, what are 3 non-medical facts your doctor should know about you? For some people, this is very difficult to come up with. All right, we have a few people still writing, so finish up your answers. I'll share the sort of most important one for me is that I am an only parent. I had children with a sperm donor, so I am my children's only parent. So not only am I the breadwinner, I'm kind of the center of that. So if I was dealing with a pretty serious situation in a doctor's office, I would want them to know that about me. Then the other two sort of fade away, so I'll start circulating so we can hear from others. Sure. So Mary takes an active role, will have a lot of questions for you, and wants to be able to digest and be comfortable, right? So that's great. Some people want a lot of science and a lot of facts. If is Cynthia in the room, she would be probably one of those people.
I love listening to music, so I always need to have my hearing, and I like writing poetry, so I always need to use my hands. So just the two things that I never want to lose my hearing on my hands.
Right, some art. I like that.
I want them to know that I believe in alternative therapies and the power of prayer, and that that is very important to me, that is respected.
Sure. Great. Good one. Excellent. Anybody else wanting to share? Yeah. Mo.
I lie a lot.
Okay. Yeah. Yeah. Yeah.
So I have to tell them up front that, like, you're going to have to check me because I lie. Ask my kids. They'll tell you the truth.
You might want to put me on the scale because the 110 on my driver's license. Yeah.
Well, that, yeah. But, you know, big stuff, too. Like, yeah, I'm totally compliant. I've totally been taking my medicine. Yeah, you know.
Sure. Got it. Thank you.
Actually, I like this question because my health plan just instituted this in we have a My Chart system that we can log into, and they asked us to fill out a lot of these questions, and my doctor, I just had an appointment, and she actually read it. So for mine, I live by myself, and with my mom gone, I don't actually have any family near me anymore, and so I drive myself everywhere, but I also like alternative therapies.
Got it. Good. Thank you. That's super important for them to know. Anybody else have one? Yeah.
I just recently went to a few doctor's appointments and made sure to weave this into my appointment because of influence from NPAF. But my three are: I'm a power lifter, I'm adopted, so I never know my past medical history, and I overthink everything. So if you're going to tell me news, make sure you know for sure. Otherwise, it'll keep me up at night forever.
Good. That's awesome. Yep. Oh, you sparked one.
So I'm a single mom. I have a 15-year-old son at home. I'm very active. I run half marathons. I do stand-up paddleboard. I do yoga. So you have to know that don't do anything to me that's going to interfere with me being active. Third thing is I agree with Mary. I want them to know I'll know a lot about this stuff, and you're going to have to talk to me and treat me like a peer.
Good. Okay. Right next. Yep.
I want to share something. I lost a very dear patient earlier this year in March, and she was 101 when she passed away. And when I came to this job, it was 10 years ago, so I got the opportunity to take care of her for 10 years. So it's three things that I knew she loved that I know that I shouldn't interfere with: that she loved to fish, that her faith would eventually outrule everything, and the fact that she took care of her 56-year-old son, so I had to be mindful of that when we scheduled her appointments.
I love it. So I consider this kind of question a little bit like, for many people my age and probably in the room, you wrote a birth plan, right? And you wrote the birth plan when you were pregnant so that you could sort of communicate the kind of person you are. The birth plan goes out the window the minute you start actually birthing your child, usually, often, right? But like that way, I feel like it's a little bit partly like using this Hello tool where you start your wheels churning on some questions and think about how you want it to go, if it's ideal. So question 30 is, what time and place have you been most comfortable in your own skin? I'm going to say right now, here, leading the group, right? And we have time for this might be our last one, or we may have one more, but we're getting to the end of the game for this session. Okay, who wants to share their answer to question 30? Yeah, great.
The most comfortable that I found myself was actually when I attended my first medical conference for the connective tissue disorder that I have, which is Ehlers-Danlos syndrome. And being that it is actually your collagen in your skin, the crazy things that I've noticed within my body and everything growing up, that it was normal to everybody else. So that was probably the first time.
Good, that's great. And literal. I don't think we've ever had an actual literal answer to that one before.
The place doesn't matter as long as I'm with my husband and my children.
Oh, okay, good one. I'll say for the horsewoman in Nevada, it was riding horses. We remember that, yes.
It's usually when I'm with my arthritis family. The community that we've built over the last 20 years, going to the conferences, and when I'm around people that look like me and have experienced the same thing that I have throughout the years.
Yeah, it makes a lot of sense. That's why this is also a great game to play with that community, right? Because it's a good sharing and bonding experience.
This may sound like I'm trying to be funny, but I'm not, because of your own skin. But in my bathtub late at night.
Yeah. I like it. Oh, Shanta's got one, or she was dittoing you, yes. Okay.
For me, I would probably say it was February of this year in Memphis at a community event, because for me, in the community with the individuals that we're trying to serve is where I feel most comfortable.
Thank you. Great. Anyone else? This will be our last share. There are a couple more questions, but you've got a book full of them. So I will wrap up by saying this is a game that and a tool really is, and I know that when I'm talking to others, and tomorrow we're going to talk a little bit about how to plan a campaign or an event, which is another hat I wear. And when talking to them, I started the first few months I was working on this as calling it a game, and I was meeting with some health professionals, especially at the state level, and they were saying, call it a tool, because everyone wants a tool on how to better explain palliative care. So I will encourage you to call it a tool. I will encourage you to play the game at home with your family. We can make them available to you, and you have these books. And if you're smart, you'll grab a couple extra from the tables. And Rebecca Kirsch, who is the person who introduced me to the game and NPAF to this awesome palliative care tool, is just going to kind of connect all the dots here and tell you a little more about why she chose this as our tool.
Thank you, Sheila. It's fun. Thank you all for your generosity in sharing some of the stories. It does bring us together, and the point of this is sort of simulating a little bit of how we open the Can We Talk community outreach and education events that we're just starting to launch as an advocacy tool to help communities and your peers be part of the process. Remember yesterday I said we need to bring person-centered care everywhere and help people have the words to use to get the care that they need. Our Can We Talk campaign is focused around that objective. And so Can We Talk is a great name that Shanta came up with. She gets credit for coining the term for us as a major campaign for us to bring into communities the opportunity to learn the scaffolding, the skills for building that echo chamber of public demand around talking about the circumstances that are important to you that surround whatever the medical condition may be that you or your loved one is dealing with. And I think it's important, and I'm glad we captured some footage today, because it's hard to describe in words what Can We Talk achieves, and some of you who've been part of the earlier pilots that we've done can speak more directly to the impact it can have on people to make them feel confident and comfortable talking about the circumstances, the constellation of their lives that matter alongside whatever is the matter. And that's really the fundamental core of what we want to bring out into the communities to help others share that comfort, that confidence, and we hope the passion that we can recruit more into our grassroots network through this experience with a range of topics. We start with person-centered care, which is grounded in palliative care principles, because palliative care really is the medical specialty that is focused on what matters to you alongside what's the matter with you. And so we want to help spread the word to help people understand that there are resources, there are tools like Hello and others that are important icebreakers to think about the quality of life that you want to experience right alongside the disease-directed treatment that you may be experiencing or your loved one may be experiencing. So the opportunity we have to help people have the words to use and feel confident in demanding this kind of person-centered care, that's job one for us, alongside what we're doing in the policy sphere to advance legislation and policy change. So this community outreach piece in Can We Talk, and that campaign is a key part of the larger strategy for this organization to help bring person-centered care everywhere. And we want to make it fun. Sheila makes it fun. All of you can make it fun because there's ways to personalize the way that we bring this to communities and hear the input from all of you, which is what the exercises this afternoon and tomorrow are really about, is hearing your input about different audiences, different opportunities where we can help bring palliative care everywhere through the connections that you have. Your power, your influence, you all showed us your expertise this morning. It was outstanding and motivating and humbling to hear the stories shared today. It gives us all such oomph for the work ahead, and I hope it did for all of you. Package that power, bring it into your communities with the projects that we're going to be workshopping this afternoon and tomorrow, because that's where the real power happens. That's where influence really happens, on the ground, in communities. All politics is local, especially now, and we want to help support you. We have great tools. We want to hear your ideas for other opportunities to bring that power and that influence and how we can help support you. And that's what this afternoon is going to be about. But thank you for this, and thank you, Sheila. It's a great first start to kick off.
Okay, we want to hear about what some of our current volunteers have been doing in their community, so I'm going to call on some of you. So I think what we're going to do is we're going to start with Judy, who actually attended a Can We Talk event in Richmond, Virginia, and I just want you to share your impression of it.
Well, I kind of dreaded the hello game. I guess because I'm uncomfortable talking about some of this stuff. But actually, it was kind of fun, and it was very interesting to hear what other people said. And I thought we had a really good turnout, didn't you? And, of course, got to meet different healthcare leaders in the community, too. So it was good.
We're also going to have Michael speak on that, but unfortunately he couldn't get over here on his scooter. But it was an exchange. He sat on a panel with a physician, and they went back and forth and talked about different issues that come up between a doctor and a patient. And so let's go with anybody else want to share anything about Can We Talk that have participated in one? Unfortunately, the two people that besides Judy, they could not be here. So we'll just move on. Rebecca gave an amazing explanation. So I'm going to call on Mary and talk about the Get Covered campaign and what she did in her community. And all of you are going to have a chance to participate in that soon.
Thank you, Donna. It's so important to get covered and get insurance. And we had flyers that we had, and I try to think, where could I go that would have the greatest impact and get to the most people? So I had gone to waiting rooms and doctors' offices and left flyers. I had emailed flyers out to hospitals, the PR marketing department, to make sure they could get it on their network. I went to libraries, because a lot of people still go to libraries, bulletin boards, grocery stores, Facebook, anywhere I thought would be relevant to making sure people could see when they could get covered, how they could get covered, and made it an easy process. I went to Rutgers Cancer Institute, Robert Wood Johnson, and I asked people to participate. You know, here's a bunch of flyers. If I send a link, will you print some out or send emails out? Social media is a great place too. There's a lot of groups on Facebook, different groups that you can get the information out to. So that's what I did, and we had a good response. I worked with one of our coalitions that we were working with, New Jersey Citizens for Action, and they took a big lead on Get Covered, so I partnered with them to see what they were doing and how we could also share that influence around the community.
I don't know if this was explained, because maybe I was staring at the chocolates on my table, but Get Covered is the when the Medicare Advantage or the Medicare plans are announced. It's actually, the dates were just announced. It's going to open. It opens October 15th and goes through January 7th. December 7th. Sorry. So it's a very short window. It's how they control who comes in. And under the Trump administration, they almost defunded the advertising for people to get into the plan, and so groups like ours and the Cancer Society and others have taken on getting the word out that you can get your insurance during that period. So Get Covered is about Medicare sign-ups for plans and the Affordable Care Act plans, right, for people who are taking advantage of those. Anyway, so when you hear that, because you're going to hear a ton of advertising now by private plans and things and groups like ours.
Thank you, Sheila, because I know some of the things that we're talking about are new to our new volunteers. Can We Talk, our Get Covered campaign. Actually, Nicole is the lead on that, and so you're going to start hearing a lot about that, and you're going to have an opportunity to participate in that campaign. So basically, we want to hear about what our volunteers are already doing in the community. So I'm going to move over here to Sabrina, who's going to tell you what she did recently in her state.
Hi, everyone. So recently in North Carolina, we held an advocacy day because we are trying to have House Bill 450 passed, and this is a step therapy bill. It was a great day for us because we had other healthcare partners with us, and because we all have the same message, those meetings were very organized, and we've also sent letters to the healthcare committee or all of our representatives in North Carolina during the General Assembly when they were all convening. I had the opportunity to call the offices and schedule our meetings. So before everyone went in for the meeting, just talking to the answering party, letting them know the reason that we were coming, it's like I'm not sure if it whet their appetite or if they were like, let me get off the phone and just, come on in. But either way, it was good to see the process of scheduling those appointments and understanding that the calls they're important. We leave a message, and we may have to make 3, 4, some offices call 5 times just to schedule that appointment because the message that we are sharing is so important. But the bill hasn't passed yet, just so you know. We're still working on it.
Yeah, and hopefully it'll pass next year.
She would have started with the bill passed.
Right. So we lead the Step Therapy Coalition in North Carolina, and so it's the first year of a 2-year session, and she's basically taken the lead of managing volunteers there. So she's really showed a leadership role. Yeah. So, Tom, you want to talk about anything you've been doing? Or hello, you participated. Yeah, we're just looking for.
Well, as Sheila said when she was doing her presentation, we did an advocacy day at the Capitol and brought in folks from all over the state, and we did some training because too often people just gather folks together in a room like this and say, okay, let's go meet with legislators, and they don't know what to talk about. So we felt it was important to have something other than just bills to talk about, and that's why we asked Sheila to come over, and it really made an impact. And as a state that has a palliative care council, it fleshed out some things for people. So I was hearing from people 2-3 months later saying, where's my game? Yeah, address problem. But they really were moved by just the fact that we talked about something totally different than just legislation. And I think that's an important thing to keep in mind, because we can all get built up, B-I-L-L-E-D. We can all get built up to the point where just in one ear and out the other. And so that, and then we put together a chronic care collaborative, which is really making a difference in legislation and just bringing people together to talk about some of the issues we're talking about today.
Okay, so Jamie's gonna call on a few people about advocacy, or maybe one. I'm not quite sure. Two.
Thank you. So one of the big initiatives, ongoing initiatives on the advocacy team that has been going on since before I joined NPAF is called the Skilled Communications Workshops. And they are primarily led by Chris and Gwen, but they are workshops that are co-created based off of the needs of the community that we go into. And we're actually in the works of planning 2. So I wanted to have 2 of our leaders speak about what they are doing with our team. One is taking place in the spring in the Mississippi Delta with Tammy Taylor. And so she's going to talk a little bit about what we are working on.
And it is in the beginning phases, so I do not have a whole lot of information, but we did have just a very small meeting on last night, and we discussed different things that ideas that we may do in Mississippi. It's scheduled for March the 14th, 2020. It's going to be a communications skilled workshop. But in that, we're going to discuss cost of care and other issues that are surrounding people in the Mississippi Delta. So, like I said, it's in the beginning phase, but I think from the conversation that we had on last night, I think it's going to come together beautiful. We're going to perhaps not have we're going to have a very small story slam where the patients actually get the opportunity to share their story. So I think that's going to be very empowering if it was like anything today. So that's where we're at, and to be continued.
Yes, and this was birthed. Tammy actually spoke on a panel with one of her patients last fall at Policy Consortium, which was themed the cost of care. And that was an illuminating experience, and we decided we wanted to go down and go into that community and see how we could collaborate. Ms. Dorothy? Yes. Shame. Mm-hmm. Doctor.
Some of the things I've been doing in my community is I set up something called a cancer survivor ministry. And the reason why I did that is because many of the people in my community aren't educated about what they need to be educated about in health in a cancer survivor. They don't know about hospitals like MD Anderson treatment facility. They never heard of it. They had no knowledge that they could be flown and compensated for the flight. They don't have to pay for it. So what I did is set up a ministry where an example was the lady who had multiple myeloma, and she was afraid to leave home and go to Texas. And in 24 hours, she told me before she had to leave, she called me and said, "Dad, I don't have the money to go to Texas." I said, "It's too much money in the universe for you to be worried about money." So I found 12 people who wouldn't say, "Why don't she have some money?" Because she taught school for 30 years. And they gave me $100. So I ended up in 24 hours with about $2,200 for her to go to MD Anderson and live in a hotel. And so part of the ministry is to educate people about what's available for them in terms of treatment. They have no knowledge of it. And then we also provide support for people who just need somebody to hear them while they have cancer. Just somebody to spend some time and hear them out in what they're going through as persons surviving that experience. So sometimes I get real frustrated because it seems like I'm alone in this. I can only get people to volunteer who really understand the dynamic. And so a lot of times it's just me calling up people when I find out they have cancer and sharing with them what's available for them and then giving them the option to either participate or not to participate. And a lot of people don't go to MD Anderson, but I highly recommend that. And a lot of times doctors in Alabama, 22 miles from me, Dothan, will not share information with cancer patients that there is another level of treatment because they want to keep them under their supervision to get that Medicare or Medicaid money, all right? And another thing that I started to do recently is it's bad when you have a medical condition and it's raining in your house. Your roof need to be taken care of. And you got a medical condition, your floors are falling apart. This is real. I can take it Advil so you can see it. So what I did, I knew that USDA had money for housing for people who could not afford to rehab their houses. So instinctually one day, I invited them, USDA, to come to my church and talk about what was available in housing to help these people who are also with chronically ill people who also their houses are falling apart because they don't have money to restore it. And I didn't believe the man who was a presenter when he said that they have no money. So instinctually, about 8 months later, the Holy Spirit said, call him up. But don't call him, call the director. And I called her and I said, I got folks over here who have chronic illnesses and it's leaking and it's raining in their houses. And she said, Dorothy, can you bring those women over here? I said, yeah. She said, we got some money. You need to get these people enrolled in the 504 rural housing program. I said, oh my God. So now what I'm doing is getting these people whose houses are falling apart, and they are actually completing the applications to get those houses restored. Rehab, they have a grant that's $7,500, which will repair a roof, okay? So I think I've done about maybe 50 or 60 applications. The sad part of the story is that I'm on the city council for Abbeville, and I'm the only African American person on there. And when I presented this to the council and the mayor, that I needed paper to run the applications for the constituents, they said they could not run 20 copies for me at the time, that I would have to call every time I want something ran off the mayor and request for the secretariat to run it off for me. Wouldn't give me 20 at the time. So that, huh? Okay, do you understand?
No, I understand what you're saying.
Okay, but you know, I'm used to racism.
Yeah.
That didn't bother me. I just got angry and I made a way. I said, okay, what I have to do? I'll call you every time and endure your oppression. And when the people come, they come to my house. I call and say, I'm sending you an applicant, and then they go to the city council, to the place to get the paper ran off. It is mean to not just run 50 copies for me at one time so I could have them to give out. But this is what I have to endure as a city councilwoman, okay? I just wanted to share that side of the story. So the good thing about it is that we are getting the applicants completed, and we're waiting to hear from USDA if they are gonna fix the housing. I hope that they do, because a lot of these people are suffering from chronic illnesses. So this was an intervention that I'm happy to be able to be a part of. And this money is not just available for Abbeville. This money is available for the whole county, okay? And this is an intervention through USDA that for 50 years we had no knowledge that it was available when it was available. It was available, but nobody advocated for it, okay? So these people were denied that up until now, okay? The third thing that I'm involved in is the untold story of veterans in Henry County. You would laugh at me if you saw me sometimes. I'm sitting on the front porch, and here comes this disabled veteran who's dually diagnosed. He's chronic schizophrenic, and he's substance abuse. He rides through the community on his back, and I know that sometimes I can't approach Mose because he's argumentative and he's not going to hear what I'm saying. So I had to pick the time when I talk to him. He's also homeless. I moved back to Abbeville in 2006 from Boston. He was homeless when I moved back there, okay? So within the last 3 months, I stopped him one day. He was on his bicycle. I said, come here. I said, I'm tired of watching you being homeless in this neighborhood. I'm on the city council, and that worries me. Would you come talk to me one day so I could help you fill out an application? Yeah, Dad, I'll do that. So one day I'm sitting in my den, somebody knocked on the back door. Mose shows up. I said, oh my God, I'm so glad you came. He sit there, I fill out an application for him for housing in a little apartment complex they have in Henry County. Last week, he came to say he wanted to get it so he could send it to the people. And I said, no, I'm gonna give you a copy, but I'm gonna send it, and me and you're gonna walk it down there, because you're living over there without no water and no lights, and you suffer from mental illness and substance abuse addiction. So we're gonna walk it. So it's completed, and when I get back home, he came the other day to get it, but I was doing too much. I couldn't stop. I said, wait till I come back, and we'll get it done. So I've also contacted the VA, and there's money available for disabled veterans. If you have a chronic illness, if you're 62, you can get someone to paid to wait on you, like do your errands, go to the store, pick up your medicine. It's $1,200 that a veteran is available for a veteran if he's disabled. And a lot of these men and women in my community had no idea that that money is available. So I got someone from the VA to write me a letter and send me an application so that I can have a forum for the community for veterans, so they can start to get the money that they deserve, that they have no idea that's available for them.
Sure.
I'm here on vacation time. I want to preface what I'm going to say next. When you mentioned that you don't know about, a lot of people don't know about cancer, what's available, resources, all of that. Well, I've been based in a cancer education center at a large medical complex in Minnesota. And I'm going to give a phone number that people can call. It will be answered by about 150 staff, so you will get a real person. Maybe on hold for just a little bit, but you'll get a real person. And if you want to know about the latest research, if you want to know about how can I find out about what's going on for multiple myeloma, I was actually going to offer that to someone whose family member was just diagnosed or something like that. Yep, this is the phone number that people can call. They will be asked their name and contact information and what the diagnosis is. Okay, I just want you to know that. But it's 855-776-0015. Again, it's 855-776-0015. In my professional life, I coordinate what's known as the Clinical Trials Referral Office for the Mayo Clinic Cancer Center. And I talk with the public. There's thousands of people that contact us about what's the latest in cancer, provide resources, help them connect with opportunities for studies. And I was going to help someone else on stem cells. Dorothy, I was going to help you with stem cells. So there's a lot of interesting research. And again, I'm here on my vacation time, but if there's anything that I can do to help cancer patients, it doesn't matter where they live in the United States. They do not have to be a Mayo Clinic patient. We help anybody with information.
Thank you, Tony. That made me think of one thing. We do want you all to network and stay connected, and one way that we want to keep you all connected post-patient Congress is to share contact information for everyone that was in attendance. So we will be sending out a spreadsheet with all of the volunteers and advocates that were here so that you guys can stay in touch. I'm going to turn it over to Donna to move us into the next.
Okay, before we get started on the next portion, I just wanted to ask how your meetings went and if a couple of people want to share. Also, you know those forms I gave you 3 for 2 senators and representatives. You could turn those in to me